Hello everyone, this is Chadi Alraies from NCVH 2023. I'm really privileged today to be with Dr. Diaz Sandoval, who gave a phenomenal lecture about the importance of CO2 angiogram in patients with CKD. Larry, thanks for being with us.
Thank you for having me, and thanks everybody for being in this conference. We have been talking about this subject for many years, and it's amazing the amount of education we still have to provide to the primary care physicians, to nephrologists, to endocrinologists, and to cardiologists to begin with, right? Yep. As we know, the prevalence of diabetes continues to increase. With that, the proportion of patients with CKD continues to increase, and our patients with CLTI are highly represented by patients with CKD. As we know, CLTI is a multi-level disease, means those patients have disease in the aortoiliacs, fem-pop, and below the knee, below the ankle vessels, which means many times they are supposed to be subject to multiple procedures. Multiple procedures with long occlusions means multiple exposures to contrast. And that, of course, all goes into a vicious cycle of contrast, more damage to the kidneys, etc. Because of that, many nephrologists, for instance, are afraid of referring these patients because they're concerned that they're going to get their kidneys destroyed. And I just want to continue to take the voice to make people aware that in 2023 we have a lot of options to minimize that damage.
Yes.
Okay. The use of CO2, for instance, is one of those tools. CO2 has a very high diffusion capacity, which makes it very easily eliminated by the lungs, so it's not toxic to the patient. It has no inherent nephrotoxicity either. And it has been shown to be a magnificent tool to image vessels. So one of the things that I do in all my CKD patients is we do CO2 angiography. Then you can combine that with the use of extravascular ultrasound, for instance, and that can guide interventions with the minimal utilization of contrast. There are many cases that I sort of presented in our conversation.
Yeah.
As you can see, we can do a whole case with only 4 to 5 cc's of dye. That's it.
Yeah.
So physicians should not be afraid of referring patients to have the appropriate angiograms they should have in order to diagnose and treat their critical limb ischemia because of concern with the kidneys. We have tools. CO2 is very useful. We wrote a paper in the Journal of Endovascular Therapy that was published in 2015, which was with the utilization of a device that is an automatic injector of CO2, produces high quality pictures. Most labs have nowadays an integrated software for reconstruction of images. When you temporize the sequence of images, it eliminates that distortion of the column of CO2 that many people get bothered by. But that's easily resolvable nowadays. That was okay maybe 5-6 years ago. Nowadays it's available for most people.
Right. And the quality of the images, I just want to reiterate again on this point. You showed us an angiogram with contrast, an angiogram with CO2 for a patient, same patient. Correct. And the lumen angiogram is phenomenal.
The CO2 many times can give you, especially in the smaller vessels, even a higher resolution. Yeah. So the belief that we cannot treat these patients, I insist, needs to be mitigated, needs to be eliminated, completely destroyed. We have enough evidence to show that we can use this tool efficiently for our patients. We can help more patients than before in a better way, with better images and no nephrotoxicity.
Is there a learning curve to do an angiogram with CO2?
I would say probably 5 to 10 cases, tops.
To understand how...
In reality, safety issues definitely, even though it sounds common sense, but I've seen people doing things. You definitely do not want to have any catheters that go above the diaphragm. You want to be below the renals if possible. I try to not even go there, so I try to get to the aortoiliac bifurcation and from there down. There can be complications if injected in visceral vessels, so that non-obstructive mesenteric ischemia can develop.
As long as you are selective and you are distal.
Correct, but it's like I tell many people, many times people have a catheter in the abdominal aorta, and unless it's a pigtail catheter, the tip might be in a visceral vessel if you don't really pay attention to detail.
Correct.
So you have to be very detail oriented. It's very easy to avoid, but it's very easy to fall in if you have lack of experience or you're kind of in a rush.
Yes.
So do not rush anything in the abdominal aorta if you're injecting CO2.
Yeah.
Make sure that you are with a special catheter, not an end-hole catheter, but a pigtail, for instance, or an omni-flush type. And be sure that you're not selected into a visceral vessel.
So you mentioned something, so the vicious circle you mentioned, diabetes, CKD, and PAD,
Correct.
and CLI.
Correct.
So now by doing CO2, you are breaking this vicious circle and taking the doubts and fear from nephrologists.
There should not be any concern that they're going to have repetitive exposure to contrast. They're going to have repetitive exposure to CO2.
Yeah.
But that's, as I said, has no nephrotoxicity, has high quality images. We can help more patients in 2023.
Thank you so much, Larry, for your time.
My pleasure.
And for sharing your experience. Watch these videos and others on the NCVH YouTube channel. This is Chadi Alraies from New Orleans. Larry, thanks so much.
You.
All right. Thank you so much.
Thank you. My pleasure.